Union Test Preps, Basic Nursing Skills Practice Test, for the CNA exam. There will be a brief pause after answer choices are given. This is a great time to pause the video to solve. Question 1. Which is the best place on the body for a CNA to check a patient's pulse during routine vital sign measurement? A. Carotid artery, neck. B. Popliteal artery, behind the knee. C. Radial artery, wrist. D. Femoral artery, groin area. The correct answer is C. Radial artery, wrist. For routine checks, the radial pulse at the wrist is standard because it is easily accessible, comfortable for the patient, and safe to measure. Carotid, popliteal, and femoral pulses are typically used in special circumstances. Question 2. A CNA should perform hand hygiene. A. When the supervisor instructs them to. B. Only before starting a shift. C. Before and after every patient contact. D. Only after touching body fluids. The correct answer is C. Before and after every patient contact. Proper hand hygiene is crucial to prevent infection and should be done before and after all patient contacts, after touching potentially contaminated surfaces, and anytime hands might be soiled. Question 3. When transferring a patient from bed to wheelchair, which of the following is the safest action? A. Using a gait belt. B. Lifting the patient by the arms. C. Pulling the patient up by their clothing. D. Letting the patient stand on their own without support. The correct answer is A. Using a gait belt. A gait belt, or transfer belt, provides stability and helps protect both the patient and the CNA from injury. Pulling by arms or clothing is unsafe and can cause harm. Patients who need assistance should not stand unsupported. Question 4. When making an occupied bed, which of these steps is most important for patient safety? A. Leaving the side rails down. B. Asking the patient to stand beside the bed. C. Keeping the bed in its highest position for easy reach. D. Keeping one side rail up when turning the patient. The correct answer is D. Keeping one side rail up when turning the patient. Keeping one side rail up while turning the patient prevents falls and maintains patient safety. The bed is generally kept at a comfortable working height for the CNA, but side rails or careful positioning should be used to protect the patient. Question 5. Which of the following is an example of proper body mechanics for a CNA? A. Keeping the knees straight when lifting. B. Holding objects far from the body. C. Bending at the knees and hips, keeping the back straight. D. Twisting the body when picking items up from the floor. The correct answer is C. Bending at the knees and hips, keeping the back straight. Bending at the knees and hips while keeping the back straight reduces strain on the spine, preventing injuries. Twisting at the waist, locking the knees, or holding items away from your body can increase the risk of musculoskeletal injuries. Question 6. When measuring a resident's respirations, a CNA should A. Tell the resident you are measuring their breathing. B. Count respirations right after measuring the pulse. C. Measure respirations before taking the pulse. D. Wait for the resident to tell you they are ready. The correct answer is B. Count respirations right after measuring the pulse. Often, respirations are counted immediately after pulse measurement, without informing the patient you are counting their breathing. This is to ensure the resident's breathing remains natural and not consciously altered. Question 7. The normal oral temperature range for most adults is approximately A. 94.0 degrees Fahrenheit to 96.4 degrees Fahrenheit, 34.4 degrees Celsius to 35.8 degrees Celsius. B. 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, 36.4 degrees Celsius to 37.6 degrees Celsius. C. 101.4 degrees Fahrenheit to 103.5 degrees Fahrenheit, 38.6 degrees Celsius to 39.7 degrees Celsius. D. 86.0 degrees Fahrenheit to 88.9 degrees Fahrenheit, 30.0 degrees Celsius to 31.6 degrees Celsius. The correct answer is B, 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, 36.4 degrees Celsius to 37.6 degrees Celsius. A normal adult oral temperature generally falls between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Values significantly lower or higher can indicate underlying health issues or an inaccurate measurement technique. Question 8. Which of the following statements about infection control is correct? A. Sterile gloves should be used for all tasks. B. Soiled linens can be placed on the floor temporarily. C. Standard precautions should be used with every patient. D. Hand sanitizer is optional if hands look clean. The correct answer is C. Standard precautions should be used with every patient. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infection status. They include hand hygiene, use of appropriate personal protective equipment, and proper handling of soiled linens. Question 9. When feeding a resident who has had a stroke and is paralyzed on one side. A. Place the food on the stronger side of the mouth. B. Place the food on the affected side of the mouth. C. Encourage them to lie completely flat. D. Offer liquids and solids simultaneously. The correct answer is A. Place the food on the stronger side of the mouth. Placing food on the stronger side of the mouth reduces the risk of choking and helps the resident chew and swallow more effectively. Keeping the resident upright also prevents aspiration. Question 10. When cleaning a patient's dentures, the CNA should A. Line the sink with a towel or fill it partially with water. B. Wrap them in tissue and place them on the bedside table. C. Use extremely hot water to kill germs. D. To prevent damage, do not brush the dentures at all, simply soak them in mouthwash. The correct answer is A. Line the sink with a towel or fill it partially with water. Lining the sink with a towel or partially filling it with water provides a cushion that prevents the dentures from breaking if accidentally dropped. Extremely hot water can warp dentures, and placing them in tissue on a table is both unsanitary and risky. Dentures must be brushed gently with appropriate tools to remove debris. Simply soaking them in mouthwash is not sufficient for proper cleaning. Looking for additional study help for the CNA exam? For free practice tests, study guides, and flashcards, check out uniontestprep.com/CNA.